The reassessment may indicate changes in the level type of supports needed. Supports may need to be increased or may be decreased due to development of knowledge, skills, and ability. A reassessment may also need to be completed in the event of, but not limited to, the following occurrences that can affect the steps a person is completing and/or needing support with. A change in medication route, packaging, or medication delivery system. A change in service setting. A change in the person's health status. A change in the usual medication routine. A change in functional status of other activities of daily living. A change in nutritional formula packaging. If a person who has historically been able to self-administer but due to a change is unable to do so safely, the assessment is updated. The assistance and supports are provided according to the assessment result and listed in the ISP. Training and support should be provided to help the person return to self-administration status. The person should be reassessed for the ability to resume self-administration as soon as the circumstances allow. Examples of such occasions include, but are not limited to, physical psychiatric illness affecting memory or functional capacity. New medications the person is not yet familiar with. Postoperative post-sedation. Environmental changes during which time training is needed to transfer skills to the new environment. When family is delegating to an independent HPC provider, the assessment does not need to be completed unless the team believes the person's preferences and rights may be being violated. Family must reside with the person that is receiving family delegation. Additionally, family can never delegate to an agency provider. Children under the age of 18 do not have an inherent right to self-administer. The guardian team may decide to use the assessment as a guide for planning and education. The guardian team may allow self-administration. If medication administration treatments, health-related activities are not part of the supports being requested, a self-administration assessment does not need to be done. If the team has concerns about the health and safety of a person, it should be addressed with a person-centered planning process. This may include discussion of the concerns with the person and identifying risks, providing education, and/or developing potential solutions that may or may not include direct assistance supports with medication administration. Where to complete the assessment? Complete the assessment in each setting where the person will receive medication treatments or perform health-related activities. A person-centered approach dictates the assessment be conducted in a manner that takes into consideration the location and circumstances under which the medication treatment will be needed. The assessment is done in each applicable location to determine what, if any, supports the person may need within the context of their personal environments. Knowledge and skills that may not transfer across different settings. If appropriate, a single form may be used for multiple settings. List all settings assessed. The approach to the assessment should be trauma-informed. Every effort should be made to assure the person feels comfortable, calm, unhurried, and unthreatened by the assessment process. The assessment should never be applied like a quiz or a test. Who completes the assessment? It is recommended that the self-administration assessment be completed by a person who is familiar to the person, who knows the person well, and who is knowledgeable about the person's mode of communication. Ultimately, it is the responsibility of the SSA KIP to ensure that the self-administration assessment is completed. When possible, it is recommended that a second observer be present to ensure results are indicative of the person's capacity to safely self-administer or not. The person completing the assessment needs to have detailed information about the currently prescribed medications, treatments, health-related activities, including medication name, dose, route, time, purpose, and basic side effects. If the medication treatment route is one that requires nurse delegation, a nurse must do the assessment. The assessment for self-administration of medications, nutrition, fluids per GJ tube must be completed by a licensed nurse. If the nurse does not know the person well, then it is recommended that a second observer who does, and who is also familiar with the person's mode of communication, be present to ensure the results are indicative of the person's capacity to safely administer the medication, nutrition, or fluids. If the delegating nurse did not complete the assessment for medications, nutrition, fluids per GJ tube for the person, the nurse should review the assessment prior to delegation to ensure the nurse is not delegating more supports than is needed.